Hey, it's Mickey with Motion Restoration. So in today's video, I'm going to be showing you how to do a self-massage for your golfer's elbow. So the golfer's elbow is located on the inside or the medial epicondyle. So this video is for if you've already been diagnosed. This is not a diagnosing video, but if you are noticing that you're getting some pain that is on the inside of the elbow here, then this is going to be the video for you. So first thing you're going to do is grab your lotion that has a good amount of glidability, or coconut oil works great too. So we're going to start just above where the area hurts into our bicep muscle, and then we're going to bring the lotion into our forearm. So we're just going to warm up in the bicep. We're just warming up into this portion of the forearm is called the flexor side. They flex our fingers. So we're just warming up. I just like to use the heel of my hand. There we go. And then get a little bit more into the bicep muscle just to help increase a lot of the blood flow that we need to get to this area. Sometimes we can get blocks in our bicep muscle. And then into the forearm. Again, just using the heel of my hand. All the way into the outside here. There we go. All right, I'm just gonna grab a little more lotion here. All right, now if you're finding it's difficult for you to use your hands, you can also use your opposite forearm and just press down with your opposite forearm all the way down into your wrist. Back up. Up. All right, so our forearms are nice and warmed up now. Now we're going to go into the more specific areas that we're going to find the pain. The pain is typically going to be on the lateral epicondyle here and then up and around, and it kind of forms into like a semicircular around this portion of your elbow. It's not the bone in the back, it's the one that's more interior, closer to your body there. So we're going to follow around this. So for that, we're going to go more point specific. So you can use your thumb and you're going to start at the top of the bone and you're going to go up and down, following along the bone into the area that you're really noticing a lot of pain. So if it is quite painful, I want you to stick on that area and you're going to go in circles, back and forth, up and down, and stick on that spot for a good 30 to 45 seconds. So we're just frictioning along your common flexor tendon, which is where you notice you're going to get the medial epicondylitis or your golfer's elbow. So find the area of tension and friction along there, and you're going to go all the way around until you find the bone that's on the outside of the arm. So I want you to friction all the way into where that bone's gonna start. And keep frictioning along in there and then go back. So you're gonna kind of do a few passes along this section. Back and forth, finding the areas of tension. And then we're gonna go again more specific. So I want you to dig along the top part of that bone. If you notice, your pinky finger is gonna start to bend in because we are along your flexor digiti minimi, which is your pinky muscle. So your pinky, if you're on the right muscle, your pinky will start to kind of cave in, and we're gonna go all the way into the wrist. And then you're just gonna work your way across that forearm, all the way into the wrist. We're gonna go all the way across. Now again, if it's too difficult for you to use your hands, you can also use your opposite elbow. And you can go along the forearm this way too. Nice thing is you can even do this at work because you just need a little bit of oil, and then you can just do it on your own on your desk right in front of you. All the way into the wrist. There we go. Like so. And then I like to push all the tendons, all the muscles, all the blood back up the arm. Everything back up. So we're draining, we're flushing everything up towards the armpit from the front portion of the arm. Another area that we want to get into is in the triceps region. So back in here, so we have our elbow bone. Again, this is where we're going to have the medial epicondylitis, and I want you to go just behind that. We have our triceps. So you're going to start with a straight elbow, and you're going to go and bend that elbow as you draw your hand towards your armpit. So bend, drag towards your armpit, like so. There we go. Just like that. Again, if you're noticing there's quite a bit of tension back in here, I want you to stick on those spots that you're finding to be painful. Really take your time in them. Try to get them to relax, and then flush everything up again. And then we're also going to get into our hand, because all of the muscles in our forearm insert into our fingers. So we're going to get into the thumb, into the palm of the hand. So I'm just stripping up with just this portion of my thumb here. We're just going up towards the fingers. And then we're going to get into the thumb, and I just want you to grab onto it, and you're just going to twist it back and forth. Go into the pointer finger, twisting back and forth. So we're twisting as we're pulling. Go through all the fingers. You can use your other knuckles. There we go. And then last but not least, always draining up towards our lymph nodes or our armpit. So we're going up, just like that. So you can perform this type of massage on yourself for 5 to 10 minutes a day. It is always best to take a look at the activities that you're doing that is causing the pain. You don't get rid of the cause, you won't get rid of the pain. I wish you the best of luck with your golfer's elbow, and we'll see you in the next video.